Welcome to the January 2025 Health and Wellness Policy Committee meeting for Ellevate Louisiana. Today, we will be hearing from our committee co-chair, Kathy Kliebert, about aging in Louisiana. She is one of Ellevate's founding members. She served as Secretary of the Louisiana Department of Health from the beginning of 2013 through 2015, as well as the founder of the Louisiana Managed Medicaid Association. One of her highest priorities in her retirement has been to be an advocate for our aging population, to have the ability to age in their own homes and reduce Louisiana's dependency on institutional care. So I'm going to take a minute to welcome Kathy. We're very excited to hear your presentation. I happened to hear it on accident, and I consider Kathy a dear friend. And I was in Baton Rouge. We had no idea that each other was in Baton Rouge, and she ended up being the speaker. And I was like, maybe your committee and Ellevate should hear this. So we're excited to have you here and hear what you have to say.
Great. Glad to be here. Okay. I called this Shades of Gray just because there are so many different ways that we can age. And in Louisiana, there's a, same thing, a multiple of different ways. Unfortunately, in Louisiana, many of us age in a way that we don't really want to, meaning that we don't have opportunities to stay in our homes and in our communities because we don't have a lot of options. So, and this is, for the nation, not just Louisiana. We know the number of elderly people is growing at a faster pace, much faster than the rest of the population. Thought this was a really interesting stat that U.S. Census projects people age 65 and older will outnumber children by 2034 for the first time in history. 16.4% of Louisiana residents were age 65 or older. That's predicted to be almost 20% by 2030. Which means increased demands on our long-term care system. The Southern Legislative Conference estimates that 70% of people 65 and older will need some sort of long-term care. Now, we all kind of hope that we don't want to be in that 70%, but as the stats show, many of us will be in that 70% and need some sort of long-term care. Most people will rely heavily on taxpayer-financed health programs to provide those supports. We know the cost of health care, not just long-term care, but ancillary supports continue to rise. And the care for older adults is expected to consume a larger proportion of the Medicaid budget in Louisiana, of course, because we're going to have continued aging of that population. And these are research from the public affairs PAR, public affairs, council, right? Have it down there. Now I can't even read it myself, but anyhow.
Public Affairs Research Council.
Research Council, thank you. Public Affairs Research Council. And these are stats that I gathered from them. What do most people want as they age? Again, I said this before, people want to stay in their own homes. They want independence. They want to be able to stay close to their loved ones, be involved in their communities, engaging activities. They want financial security. And again, I mentioned community. Community is really important as people age, especially if they lose their spouses. They need other people in the community. They need social experiences. They also want to be able to learn new skills. And many seniors want to be able to volunteer in the communities and help in ways that they weren't able to help when they were working. So what are long-term supports that, again, many of us might need? It's a broader way of services delivered in multiple settings. And these are things that will assist in our daily living. We're talking about, it might be just somebody that might come in and help a couple of hours a day if you have a chronic illness. It also may mean that you need 24-hour care because you have an illness and you have reduced independence and you need somebody either to sit with you or to help you in, managing finances, cleaning house, multiple of different things that people may need assistance with if they have chronic illnesses or disabilities. And again, many of these are not necessarily medically related. again, help with bathing, eating, dressing, supervision. It doesn't mean that you need a nurse. It just means that you need somebody to help you with some of these activities of daily living. And again, could be a little assistance or 24-hour care. Federal government mandates that any state that participates in the Medicaid program covers nursing home care. Unfortunately, that means you can get an automatic nursing home bed, but you have to wait for home and community-based services. And again, that's what most of us want, is home and community-based services. A lot of people sometimes confuse the difference between Medicare and Medicaid. Medicare, that's a federal program. It is not a state-based program. Medicaid is a state-based program. Medicare provides health care needs of the working population in retirement or those disabled before retirement. Again, federal program, very limited coverage of long-term care. It basically will cover your medical needs in a nursing home, your medical needs at home to some extent, but it doesn't pay for room and board. It doesn't pay for things like, again, somebody to come sit with you and help you provide those daily living skills. Does not cover most home and community-based services. Medicaid, however, again, state-based program, it's a needs-based health program for the poor, elderly, and those with disabilities. It's designed by the state, combination of both state and federal funding on a cost share basis. And our rate is really good because it's tied to poverty rates, and we have a high rate of poverty in Louisiana. Total budget for Louisiana Medicaid last year was $18 billion. Most of this federal funding, a little over 13 billion of that is federal funding. Primary source of funding for long-term care services. So the majority of people that get long-term care services they're paid for by Medicaid. And again, these are people that are medically needy, not those that are independently wealthy and that have the means to remain in their homes or to pay for nursing home care on their own, which unfortunately is not the majority of people in Louisiana. So what options do we really have? We have institutional options. And again, nursing homes, state license to provide professional nursing and rehab services. The largest percentages of institutional spending with regular rate increases provide through what they call rebasing, which means that they don't get cuts and they get automatically increases every year based on what they think the costs are in the nursing homes. Unlike home and community-based services or any other services, that they're kind of guaranteed, not just that their rates won't be cut, but that they'll get rebasing increases. The budget has grown from $904 million 10 years ago to $1.3 billion this year. Currently, about a little over 17,000 people currently that are in nursing homes, a lot more licensed beds than that, but about 17,500 people currently living in nursing homes. And they're paid a facility-specific rate. Basically, usually the average $45,000 to $52,000 a year per resident. And again, some people can afford that on their own, but many people cannot and are going to rely on Medicaid. There is also assisted living as an institutional option, and these are facilities that sometimes in conjunction, they have a nursing home and an assisted living. There is no Medicaid coverage for that. That is private pay only, and it's an option for people who have means that can go and into a facility. They can get 24-hour care, but they're paying for this on their own. And they usually those people that go into assisted living don't need skilled nursing. They need, help with their medications, help with their daily living. They need somebody kind of round the clock, but not significant medical needs like that you would need with a skilled nursing home. So talk a minute about one of my favorite subjects, which is nursing home quality in Louisiana. Many of you know this. I mean, we absolutely have the worst quality nursing homes in anywhere in the United States. The Center for Medicaid and Medicare Services, CMS, they have a quality rating scale for nursing homes, and it goes from 1 to 5. In USA Today, this was as of December 2022. That was the most recent stats I could find. The CMS average nursing home ratings by state ranged from the best, which was Hawaii, 3.9, to the worst, which was Louisiana at 2.34. And that's rating 264 nursing homes. And I want to point out, I just saw a report yesterday that looked at this same area back in 1998, at which point there were 267 nursing homes, and the same results back then. We were the worst in the United States at that time as well. U.S. News reported that CMS data, this is more recent, just from May of last year, 42 and a half, and this was the stat I didn't know before I did this research. 42.5% of Louisiana nursing homes were designated as problem facilities. And again, the most of any state. We had the highest percentage of problem nursing home facilities. And those are determined by CMS to have a history of service quality issues or involved in a special program to improve quality, meaning they've been cited numerous times, so they place them in programs to try and improve that quality. Unfortunately, many times what happens is they may improve 1 year and then it goes right back down, or they may only improve a little. They're still going to be a problem facility, but because they're improved, they never shut down. And like I said, you look at the numbers of nursing homes from 1998 till now, there are only 3 less. And actually, I'm pretty sure those were not shut down. They were people who voluntarily decided they wanted out of the business. I'm actually working to get some more data from LDH on any nursing homes that have shut down. I know after the Bob Dean issue in Independence with the nursing homes there, my understanding is there were some on closure tracks, but again, I don't have the recent data on that, and I'm trying to get that. So U.S. News also does a survey of best nursing homes nationwide based on a variety of all sorts of indicators. And lo and behold, Louisiana is ranked last in nursing home quality. So very, very disturbing to me that we have for so long had poor quality nursing homes. And when I was secretary, and actually started when I was deputy secretary, toured many nursing homes in Louisiana, and was really rather appalled at the level of care. Many people don't recognize how bad it is. They don't, if they have somebody that's in a nursing home, there's lots of stories out there about bad quality. But what usually happens is, because people typically their average stay in a nursing home is 1 year. They usually die within 1 year. So as sad as this is to say, it doesn't become an ongoing problem for a family. They get really upset, and you would hear stories, and they would be like all up in arms, and then their relative either moved out of that home or passed away, and it doesn't become an issue anymore. So we don't have a very large advocacy base in terms of people that are out there trying to really improve that quality of nursing homes. One of the things, and I'm going to talk at the end about some ideas I have about some things we can do, but my biggest thing is that I'm fed up, and I just want more people to understand how bad the nursing homes are, and be willing to really go to the legislature and talk about the fact that we shouldn't stand for this anymore. This is not acceptable. It's not acceptable for our schools to be low quality schools. It's not acceptable for developmental disability institutions. It's not acceptable for hospitals. But for some reason, we accept it in our nursing homes. And again, hoping that maybe there's some things we can do to change that. So there are some national efforts to improve the nursing home quality. There are actually new standards that were finalized last April, which increased the minimum number of registered nurse and nurse aide hours per day. Registered nurse on staff, 24 hours a day, 7 days a week. That's not a current requirement. which you'd think it would be, but it's not. And right now, Kaiser Family Foundation estimates only about 3% of the nursing homes in Louisiana meet these new requirements. It's basically an unfunded mandate. Meeting the standards will drive up nursing home costs. We know that, and the Medicaid budget, but it's not, they're not giving us, the federal government's not giving us additional money to pay those additional costs. So there are these standards that have been, they keep actually getting pushed back, I'm sure, by nursing home lobbyists who, understand they can't meet them right now and are trying to garner as much time to be able to change them or to, to be able to get additional money to meet these standards. My hope is, again, that there's some things that we can do to push Louisiana to be one of the first states to make this compulsory and make these new standards, a requirement in our facilities. And we have the ability, the department has the ability to increase the standards through rules and through legislation if they wanted to. So what are home and community-based services? I mentioned, I went a little definition about them before, but again, variety of services that are designed to allow people to live in their homes and communities. There's several programs in Louisiana Medicaid that provide home and community-based services. We have long-term personal care services. It's not 24-hour care, but provides help with activities of daily living and supervision on a limited basis. There's the program of all-inclusive care for the elderly called the PACE program. It's a day program providing comprehensive services to seniors living in the community. It's very limited. There's only 3 sites right now, 3 zip codes, New Orleans, Baton Rouge, and Lafayette. My understanding is that they're trying to move into Alexandria, that there's some additional funding that is maybe available for that. But right now, only 3 spots, so not real helpful for many in Louisiana. And it's an excellent, excellent program that can keep people out of institutions, keep them in their homes, and provide a variety of medical services, social activities, other activities in a facility during the day where people can still live in their homes and be with their families in the evenings. Adult day health care waiver, also a similar type of thing, although it's not as comprehensive as the PACE program in terms of services, provides some health care and activities, only about 5 hours a day, but it's, again, very limited because it's a waiver that requires a waiting list before people can be provided that service. And there's also not an abundance of those services throughout Louisiana. Community choices waiver, these are services in the home, which includes meals, maintenance therapies, in-home monitoring, assistive devices, nursing assistance. This is a much more comprehensive waiver that provides for people to, again, stay in their home, get the services they need, provides for staff to come in and provide those services in the home. Waiting lists for many of these services we talked about, especially the community choices waiver. There's the waiting list of almost 5,700 for community choice waiver for those individuals that aren't receiving other services. Currently, our home and community-based services serve about 17 to 20,000 people annually, with a range of 23,000 to 38,000 per person. So significantly less than the average for nursing home care. There are non-Medicaid options, private sitters. It's very high cost for anybody that has ever worked with their family member trying to provide without Medicaid assistance, without any other financial assistance, provide 24-hour care, or even, maybe 16-hour-a-day care for your loved one. It is extremely expensive. It's very hard for most people to afford because it's well over $100,000 a year to be able to provide those type of services. So this is another stat that I'm hoping eventually will change. We've actually for years tried to point this out and tried to somehow readjust the spending percentages that are used on home and community-based services versus nursing home. So you look at this, Louisiana spent 20% of its long-term care funding on home and community-based services, compared to 62% nationally. Again, this is one of those stats that I see, and you tell people, and you just wish that somebody would say, Well, this is ridiculous. Why are we doing this? Why are we not providing at least 50% of our funding for home and community-based services? But we're not, and we again hasn't changed very much over the years. There were some slight increases when we got some additional waiver programs that were approved legislatively in fiscal year 23, but again, not a significant amount to change that percentage because the nursing home costs have risen significantly during that time as well. So what is the reality of long-term care options in Louisiana? And, as I've kind of said from the beginning, what most seniors really want are not truly options for many in Louisiana. And I like to tell people, some people say, well, this is Medicaid. So how does this really affect me? Well, first of all, we all pay Medicaid costs, and we shouldn't be continuing to fund more costly options, which we continue to do. But nursing home quality should affect everyone because these nursing homes are funded by either Medicare or Medicaid or private pay facilities or private pay. So that those nursing homes that I'm talking about, many of them accept private pay, and they are just, I mean, they get those same quality ratings. So there's no private pay facilities that have different ratings. There's still 42% of our overall nursing homes that are considered problem facilities, private pay or not. And besides, even the independently wealthy may find themselves in need of long-term care service they can't afford, or that you end up in a problem facility. So what can you do? One of the things that one of the organizations I belong to, and Caroline Meham, who's on here, also belongs to it. The Live at Home Coalition. There's the list of people that are currently groups that are currently part of that coalition. They're working on trying to reverse the long-term care trend by making home and community-based services more available. That's their ultimate goal. It's a group that is an advocacy group. They also support legislation. AARP takes a big leadership role in this coalition. And have been working with them and will continue to work with them to see if we can get some legislation moved forward on changing that trajectory in terms of increasing home and community-based services, but also just as importantly to increase the nursing home quality in Louisiana. I feel really strongly that, I think of things like the school voucher program and how, people in F-rated schools can have choice of where they get services, and the elderly should have the same problem, should have the same ability to have that ability to choose a nursing home that is of higher quality. And again, I'll tell you in just a minute about some of my sort of out there ideas in terms of being able to move some of this forward. But I'll be working with this Live at Home Coalition, and I do encourage anybody who's interested to check into it. There's contact information that's coming up if you're interested. All right. So what can you do? Again, you can join AARP. They're a big part of that coalition. And there's the contact information for Andrew Mule, who is the director of the AARP in Louisiana. And certainly he would support anybody that's willing to help in terms of figuring out what we can do differently for long-term care in Louisiana. So what else can you do? One of the things I always like to talk to people about is that, remember that stat, 70% of us are going to need long-term care. Well, there's some things you can do to avoid long-term care. Whoop. And, there's four major things that are most likely to affect us, not just living longer, but living well. And that's diabetes, cardiovascular, neurodegenerative, Alzheimer's, and other dementias, cancer. Those are the four biggies. And there are preventative strategies for all of these. And some people say, how do you prevent cancer? How do you prevent Alzheimer's? There are things, there are things we can do for diabetes and cardiovascular, but there are also things that we can do for neurodegenerative and cancer as well. So there's preventative strategies, screenings, exercise, nutrition, sleep, emotional health, medicine, screenings. Those things all can affect your ability to live longer and healthier. There's a book I put up there called Outlive that I've read that I encourage everybody that's interested in how to live longer and healthier. It's called The Science and Art of Longevity by Dr. Peter Attia. And it's really I mean, there's some parts of it that get a little technical in terms of how these diseases form and all the things that go into figuring out how to be more preventative in these areas. But overall, it's just an excellent book that talks about some things, some very, nobody has to, change these major things in your life. You commit to one or two things to begin living a healthier lifestyle. And every little thing you do is going to keep you one step away from long-term care. And like I said, you really don't want long-term care in Louisiana. That's what I'm working for, and hopefully many of you as well are interested in doing that. So before I end the total presentation, you can go to I have my email up there if anybody's interested and has any ideas that would like to contact me, please do. But one of the things that I am going to try and pursue this year is to figure out a way to get some of these stats in front of the legislature and to get it in front of legislators that are interested in making sure that we do something to improve the quality of our nursing home. I mean, one of my thoughts is, we should have a very minimum standard in terms of those quality ratings. And we should give nursing homes a certain amount of time to meet those standards. If they can't meet those standards, then we should close them down. And then we move that money, just like a money follows the person with a student or with, our developmental disabilities programs that allow people to move out of institutions into home and community care and take the money that they would have used for that institutional spending to be able to do that. There's also some other things that we could do. Presumptive eligibility for home and community-based care is one of the things the coalition is looking at. There are clearly some things that we could do to try and in both increase the quality in our nursing homes at the same time as providing home and community-based options. We still want to pursue, of course, additional funding. Again, I know it's going to be very controversial to actually try and see if there's some minimum standards that we can legislate, so that, because the Department of Health, who has the responsibility for doing this, has just never been able to effectively improve that quality. And like I said, there's very little difference in the last 20 years. So legislatively may be the only way that we may be able to try and figure out a way to legislate some, not just improve quality, but also some other things that would help provide more community-based options for all of us.
All right. So Kathy, thank you so much for sharing this information with us today. We are just so lucky to have you as co-chair of our Healthcare Policy Committee. Your expertise is very highly valued within our membership. We just really appreciate you and the hard work you're doing, on this particular issue that I do believe very much is outside of partisan politics, and something that I think we can really embrace and move forward with very strongly as an organization. We have mentioned it over the last several years. We've always had it in our policy priorities, but I'd love to see us get more active, because you're right, that advocacy community is just a little too small. There may not be an answer to this exactly, but how on earth does it come to be that Louisiana has such poor quality in our nursing homes? Like, what makes us different? Why do we have the highest percentage of problem nursing homes? What on earth is happening here?
Well, I mean, again, I think the majority of the reasoning for that goes way back. I mean, we initially and I'm talking about well before 20 years, didn't pay our nursing homes very much, right? They were very much underpaid. And so when you have that, you're not going to staff appropriately, which is what happened. And then sort of a combination starting from there, and then even as the funding got better, because it did get better, at that point they were staffing, their staffing ratios were low. They weren't too concerned. They, like I said, they would get citations, but very few monetary citations, very few citations that resulted in any type of real consequences for the nursing homes. And then the strong nursing home lobby, that anytime that people wanted to change it. I mean, if you went to the legislature and tried to say we should have, I mean, this sounds so sad, we should have a minimum of 3 or 2.5 even, for our quality ratings, you would be shot down immediately. Now, that's what I think we need to do, but I do think it is going to be an uphill battle, because for so long, any efforts to really, for LDH to really, put some consequences behind those citations has never been allowed to happen. So like I said, I think it started years ago with poor funding and poor, the staffing, and then now the profit margins for many of these nursing homes, because most of them are for-profit homes. I didn't mention this, but most of the homes in Louisiana that are higher quality, all your non-for-profit. So you're run by boards, not private owners. The profit margins are obviously very, very good on these nursing homes, and people aren't willing to change that to increase any type of standards or ratios, which is why they're so resistant to the new federal ratios as well.
Well, I can assure you the people that have to go into nursing homes in Louisiana are not completely excited about it. My mother-in-law right now, I'm watching her. She's almost 93 years old, and her biggest scare is that she would have to go into a nursing home, so we do everything in our power to prevent it. But it's a struggle, with people having to stay over there constantly and make sure that, nothing happens to her. So
Yeah,
one
and one other thing I'll just say on that too, we're a very poor population. We have a lot of Medicaid funded homes because we have a lot of poor and needy individuals, and also a population that doesn't have, in many cases, a lot of family support. So, one of the best ways, no matter what the institution is, to assure quality of care is to have people that are there watching you and making sure that you're doing what you're supposed to do. And a lot of these individuals that are poor and sort of marginalized don't have that type of support. So when they go into the nursing home, nobody's really checking and making sure that those ratios are followed, that they're being changed, that they're being cared for in even a minimal manner.
Well, and I can speak to people that aren't even over a certain age. I mean, we have people in our state that, have ALS or
Mhm.
some other condition where they really have to be, having care all the time. And I'll tell you that nobody decides when they have ALS to be intubated so that they can spend their time in a nursing home. And just the fact that, young people develop this disease, and there's suddenly, some of them have children that they're still trying to get through school. And not only are they having limited options, but there's nothing to help them afford the
That's
care that
right.
they need. And I mean, they have to go through everything they own in order to free up to get Medicaid. And that's not always feasible with kids. So there's a lot to consider in this. And I would really like to see us really armed with the right talking points to get more involved in this in our legislature, sitting down in front of the committee and talking to them about this issue.
One of the things I'm hoping that the Long-Term Care Coalition is going to do this year is just that, come up with a couple of, things that could really, improve, like I said, not just improve the quality, but also provide additional home and community-based services and, start tackling them, a little bit at a time. I know Senator Talbot has expressed interest. I did send him the PowerPoint, and we're supposed to have a discussion. I'm going to be meeting next week with some members of the coalition to kind of map out what that strategy would be for them, and then I'll bring it back to this committee to hopefully it being something that we can utilize at the legislature and as talking points.
Well, keep us, and I know you will, involved in that, because I would like to see us making a difference at the Capitol on this topic too. And thank you, Kathy. Thank you for sharing this expertise and for sharing your time with us today. And for those of you listening who are not necessarily Ellevate members yet, if you're interested in these types of policy talks, check us out on Ellevate's website, where you can learn more about our events, our policy committees, and our advocacy efforts, and how also to join. The website is ellevatela.org. That's ELLEVATELA.org. We're hoping to see you again soon on this video podcast, as we're excited about kicking it off again this year. And so we'll catch you next time. Thank you and have a great day.
Thank you.